This is Dr. Jacob Egbert with Primal Mountain Medical, TRT Clinic, and I'm going to talk about the top 10 benefits to testosterone replacement therapy. Now, a lot of people consider testosterone replacement therapy when they begin to notice some symptoms of low T, fatigue, decreased libido, lower muscle mass than they'd like, less energy, poor mood. There are a number of factors that can be a contributor to the symptoms of low T. And there are a lot of benefits to replacing that testosterone. And I'm going to get into the top 10 and we'll go over each one and talk about why those benefits exist connected to testosterone. Now, I want to say this to start with. There's this beautiful analogy I recently heard. When someone starts testosterone replacement therapy, I just want to point this out. The body is not immediately ready for that increased amount of testosterone flowing through their veins. Now, let me explain. So the body is very complex. There are a number of receptors and enzymes and other parts that process hormones. So, for example, if you're running on a level of testosterone that's, let's say, 300, that's on the low end of normal. Now, you're going to have a corollary or correlating amount of receptors and equipment, cellular equipment, to process that amount of testosterone. Now, the testosterone itself isn't what gives you the feeling of robustness as a man. It's the action of that testosterone on all of the machinery parts. And I say machinery parts, but there are cellular components and it gets really complex. But essentially, your body is made up of bits and pieces, enzymes, cells, things that respond to the floating through the body nutrients and hormones. So testosterone being one of them and one of the most powerful for masculinity. So let's say you're riding at 300. Your body is set up for 300. Then you ramp it up to 1,000. 1,000 is a great number. But your body can only use 300 for a while as it builds up the factory, the cellular components to process it, the receptors that can respond to this increased amount of testosterone. Now, this can take months, and it's about what we expect, 3 to 6 months until you get optimized. And it can take even longer to really get dialed in on the perfect dose for your body. But let's say 3 to 6 months before you're starting to feel all of these benefits that I'm going to go over here in a second. So this analogy that I heard, it's beautiful. This gentleman in a group that I follow, he says, starting testosterone replacement therapy is like dropping a Lamborghini engine in a Suzuki Swift that needs service. And I think you can just visualize what that looks like. You're throwing in this hyper powerful engine in a vessel that isn't quite equipped or ready for that. So you need to do some modifications. You need to increase all of the bits and pieces to accommodate that more powerful engine. And it happens. It happens relatively quickly, over a few months. And that's actually quite great. So when I start somebody on testosterone replacement therapy, I let them ride at a moderate dose for about 2 months. Then we recheck labs and we see the response. You know, if their numbers are creeping up, but they're not quite where I like to see them, and they're not quite feeling that more powerful engine yet, then we'll increase the dose and we'll let that ride for another few months. And then we'll check labs again and we adjust. The goal here is to optimize for your experience and your feeling. Okay, let's dive into the top 10 benefits to testosterone replacement therapy, or just in general having really high testosterone. If you could naturally produce 900 to 1,000 and it's correlating free testosterone, this is the benefit that you would feel. These are the benefits that young adult men feel in their early 20s. They're just humming on high. And here's what they are. Number one, muscle mass. When you're optimized with testosterone, it is easier to produce muscle, to build muscle. And that has to do with these finer points of the testosterone receptors and protein synthesis, but it also creates a more robust fiber. The muscle fibers grow and they become stronger themselves as a response to the testosterone. Now, in addition to this, it helps with healing and recovery from stimulus or exercise. So the muscle breakdown is actually inhibited. You have better muscle quality and it sticks around longer. So the result, increased muscle mass. And muscle mass is the powerhouse. It's like that thing that sucks all the energy, that produces power, that does action. So clearly, muscle mass is the number one benefit to testosterone. Okay, number two. Well, muscles have to move something. They have to move bone. So bone density. Now, this is interesting because actually bone density is largely connected to estrogen. So the higher your estrogen, the more healthy your bone density. So testosterone aromatizes or becomes estrogen. That's normal. In the pathway of hormone development or hormone production, testosterone becomes estrogen. And the combination of the estrogen and the testosterone enhance or increase bone density. And therefore, when their estrogen is low, if you're on an aromatase inhibitor, one of the most common ones is anastrozole. Terrible idea. And if you're on one, call me, we'll get you off and we'll get you set straight. Don't take it because it can reduce estrogen to a level that is dangerous, to where you do not have the benefits of estrogen. Estrogen is a vital hormone for men and specifically bone density. Okay. Number three, this one's pretty obvious. You hear this all the time. When your testosterone levels are high and hopping, libido increases. Sexual function is enhanced. And who doesn't want to have high libido and sexual function? Erection quality, all of the components of reproduction or having sex are enhanced by optimized testosterone. If they're low, all those things come down and enjoyment decreases. So that's a pretty clear one. So number four, increased mood and sense of well-being. Now, a lot of people will be thinking that they're depressed or they're losing their lust for life. And then they go get labs checked and they find out that their testosterone's in the tank. And then they get on therapy and the testosterone levels come up and all of a sudden they're back. Their anxiety decreases, their drive returns, and they're just motivated to go out in life and kick ass again. And that's largely related to this hormone that fuels the man's body to go out in the world and do stuff. So benefit number four. Moving on to number five, decreased body fat. Now, there's a number of reasons for this, and I'm not going to get too technical on that, but when your testosterone is optimized, clearly you have higher muscle mass. Muscle is metabolically active and burns calories, essentially, increases that basal metabolic rate. Now, in addition to that, the hormone component of testosterone decreases body fat, so you will lean out. So increased muscle, decreased body fat. Benefit, win-win. Okay, number six, testosterone replacement increases or improves cognitive function. Your brain just works better. And there's a number of reasons for this, and one of them being that it increases blood flow. Now, in addition to increasing blood flow, we've seen these interesting things like verbal memory increases and spatial awareness, or that capacity to understand things in 3 dimensions, and executive function, which is broken down into problem solving and decision making. These are all components of masculinity. When you define what a man is, a masculine energy, it's decision, it's problem solving, it's verbal capacity, it's spatial awareness and making things in 3 dimensions. So interestingly, when your testosterone is optimized, the brain fog subsides and you become a more masculine version of yourself. Okay. Top benefit number 7, increased energy. And this kind of just comes with the territory of increased muscle mass, increased mood, increased motivation, increased cognitive function. But there are other components that have been shown. Increased mitochondrial activity. And if you recall from cellular biology, the mitochondria is the powerhouse of the cell. It's essentially where the core version of your energy is produced. And so testosterone enhances all of those things and therefore results in higher or recovered energy. Okay, number 8. This one's interesting because it's part of the top 10 myths. If you look at that video before, you'll see that one of the myths is that cardiovascular function is affected and there's increased risk. Well, actually, it's quite the opposite. And supplementing testosterone or getting into that optimized level is cardioprotective. So One of the benefits of this is it's actually kind of inferred, and that is this. People that have low testosterone have a higher incidence of cardiovascular events. That's cardiac arrest, that's strokes, high blood pressure. Now, it's a question of whether, it's the chicken or the egg situation. Are the things that put you at risk of cardiovascular illness causing low testosterone? Or is the lack of testosterone resulting in some of these health problems that result in cardiovascular events? It's hard to say, but what we know is that people with low T have higher cardiovascular events. Pick your camp. Okay. Number 9. So this one's interesting too, because I didn't really talk about this in the myths component, but it is a concern. And that is that skin quality or skin, whatever you want to call this, benefit, the skin of your skin quality is better with testosterone. Now, one of the reasons is that testosterone increases the production of sebum, which is a skin oil. Now, you will recall from dogma or from things you've heard, especially in the bodybuilding world, that testosterone results in acne. You see these bodybuilders that just are all broken out on their back knee, perhaps you've heard. Well, this is common with fluctuations in hormones. So the pubescent boy, they've gone from no testosterone essentially to like super high levels. So that fluctuation in testosterone can lead to acne because you get this rapid increase in this sebum or this skin oil. And so you get a breakout, which fosters the opportunity for bacteria. And then you get acne, which is a combination of the oils plus the bacteria. And then you get a breakout. So with testosterone replacement, you actually get improved skin quality, a more youthful skin appearance when it's balanced. What happens is people will take high doses and then let it drop. High dose, let it drop. And people that abuse this and take extremely high doses and cycle on and off, those are the ones who have skin problems. So baseline optimized testosterone improves your skin. Those with fluctuating hormone levels have the risk of acne. So kind of a pro and con there, but really it's a pro if done well and a con if done poorly. All right, last one. The top 10 benefits. Number 10, sleep quality improves dramatically. Now, why this occurs, it could be a number of factors. One, increased muscle mass, increased exercise, increased mitochondrial activity, increased cognitive function, increased cardiovascular, increased blood flow. All of that enhances the overall brain chemistry. And therefore, your circadian rhythm gets back in check. So your melatonin goes up at night, your cortisol goes up in the day, and you get this diurnal effect. And so what we do know is that people with low T have poor sleep, largely, and people with optimized testosterone have better sleep, higher quality sleep. And therefore, it is a benefit. So these are the top 10 benefits. I am Dr. Jacob Egbert with Primal Mountain Medical. If you have further questions, reach out to me. If you want a consultation, schedule one. And I'm serving all those men in Utah looking for optimized testosterone.